Thank you and good morning, everyone. So taking forward from all the speakers, I want to present the Iapb Southeast Asia Regional Plans and Priorities for 2030. The strategies and approaches are all towards eliminating avoidable blindness and achieving the universal eye health. So just to summarize on what are the health challenges in South Asia, presently the high prevalence of avoidable blindness, limited access to eye care, inequity in health services, and the major cause, as we know, are the cataract, uncorrected refractive error, diabetic retinopathy, and uncorrected presbyopia. So by 2030, so what is that we want to achieve? It has been adequately highlighted. Is the strategy document of the IAPB. I don't want to go to the details of this. So what's the goal for 2030? As a common goal is to eliminate avoidable blindness, and we will be helping by creating enabling environment and system change approach. And the key strategies involved will be to advocate and activate implementation of the IPC and 2030 Insight. And again, as highlighted earlier, to galvanize support for eye health to achieve the global targets. So our IAPB strategy has also been adequately discussed. I don't want to go into the details of this. There are some of the priorities that we want our members and countries to focus on in the region. So one of the priorities is the evidence-based strategy. As it has been discussed, that there is a paucity of data. We don't have adequate data in the region. So data is actually driving policy decisions, resource allocations, and program evaluations. And the strategic actions, as Dr. Rohit and Mr. Yuta has highlighted, we need to strengthen the regional data on all the primary targets. And while doing that, we also need to utilize technologies and AI tools for making it more effective. The second priority is definitely services, strengthening the eye health systems. And one of the important tasks we have here is integrating the eye health into the national health systems. I think it's going to be a very, very difficult task, but I think that's what we ultimately need to achieve. Human resources are one of the concerns in the region. So training and distribution of human resources has also need to be prioritized. Capacity building, creating local leaders in eye health is equally important. We need to also continue developing the infrastructure, expanding the number of service delivery points. That's for the strengthening the eye health systems. Equity is another concern, as Dr. Tashi was also mentioning about the inequities in health services. So we have challenges in access, particularly for the marginalized population, the rural population, the females, the low-income communities. So the strategic actions, we need to have targeted outreach programs. We have a lot of programs, but we need now a targeted outreach programs, financial accessibility, and inclusive programs that involves everyone. Other priorities is definitely public health, promoting prevention and early detections, and our areas for focus for now is basically the cataract, refractive error, and diabetic retinopathy. Early detections, screening programs are ongoing. We need to focus more on the newborn children and elderly. The public health awareness has to continue, and people have to be aware of early detection and need for regular checkups. Definitely, strengthening partnership and advocacy is very important. We need to collaborate with more, we need more collaborations with the government, NGOs, INGOs, private sectors to increase the resource and the support. Policy and advocacy needs to continue. It has to go on, and we need to advocate now, not for making policies, but for implementing the existing policies. Innovation and research has to go on with the technology, and now with a lot of AIs and machine learning things, this should become a package of ophthalmology services. And we need to also promote telemedicines for remote consultations or treatments. Research areas, epidemiological researches are more required along the clinical researches. And low-cost interventions need to be developed. Innovative models for each countries, each districts, each areas has to be developed, because every country is unique in its own ways. In the meantime, while doing so, monitoring and evaluations are equally important. Tracking the progress is equally important. So we have a lot of KPIs that we need to keep on track. We need to also establish the monitoring and quality assurance mechanisms, and also we need to have some evaluation annually or biannually for regional as well as the national strategies. However, doing so, there may be challenges. Some of the key challenges highlighted here are the political commitments, which may lack. We may face resource limitations. We may have difficulties reaching remote areas. But in the meantime, we also have some mitigation strategies for that. That's the ongoing advocacy that we are doing at national and international level. We need to diversify funding resources for this purpose, as well as trying to expand the reach of mobile and telehealth services. So finally, in conclusion, yes, strategic plans and actions are required to achieve our common goal of reducing preventable blindness and increasing the access to eye health. And the regional plans and priorities also need to align with the global targets. So the call to action for now is urging our stakeholders, including the governments, the NGOs, the private sectors, and all eye health professionals to lend your voice and collaborate in achieving our WHO, IPC, and the 2013 site. We need to finally ensure that now eye health becomes an integral part of the national and national health policies, but also need to ensure that whatever has been made so far, the policies has to be implemented. I think that's it. I wanted to make it very brief in the interest of time. Thank you so much.
Thanks, Indra.